Craig. I'm the Executive Director of Citizen Action of Wisconsin, and I'm here to give you a brief summary of what we discussed today in a couple major summit meetings we had with other progressive leaders about the situation in healthcare and where we are in the whole healthcare reform process. I think everyone knows who's watching this that we had a great victory in March where historic national healthcare reform passed after 100 years of trying. It's important to realize, though, that that's not the end of the debate or the discussion at all. It's simply a major milestone or stage in the process. That the implementation is going to take years. It's going to require a lot of the state of Wisconsin, and so the whole campaign and all of the activity to make guaranteed affordable health care for everyone a reality has to continue in the implementation phase of national health care reform. Now, what I discussed in the longer conversation is that this bill is phased in stages. There are some initial reforms that start right away, start this year, and those are bridge reforms that then lead to more comprehensive restructuring of the system starting in 2014. So let me start with the bridge reforms. There are immediately three kinds of major reforms. There are insurance regulations to rein in some of the major abuses of the health insurance industry that cause so much public anger and which help fuel really the push for national health care reform. And those include bans on rescissions, where they throw you off your policy just because you got sick, bans on pre-existing condition exclusions for children. For adults, it's later, but children right away. So if a kid is sick, they can't be denied coverage. A kid with cancer, for example, would be denied coverage today, and their family would be denied coverage. Requirement that kids can stay on their parents' policies until they're 26 years old, requirement that preventive care be covered by health insurance policies and that it be covered first dollar, which means no deductible and copays. A ban on lifetime limits. What happens if someone gets very, very sick or someone in a family does, they will hit the lifetime limit and then run out of insurance and the family will be plunged into bankruptcy. That's outlawed. Annual limits are tightly restricted. There's also a limit on how much health insurance industry can take from health insurance premiums. They have to put 85% for large employer policies, 80% for smaller policies into medical care. The rest can go to overhead, administration, profits, reserves, but that limits how much they can take out of health insurance premiums that aren't actually spent on medical care. There's also new review of health insurance rate increases that will be done at the state level and which actually open up the possibility of curbing and punishing companies that have excessive rate increases. And that some of that is in the national law, some of that would require additional state action. There is also a number of safety nets that are right now put in place. There's a high-risk pool, a national one set up for people who can't buy insurance because of pre-existing conditions. There's aid to early retiree plans so that early retirees who are a particularly vulnerable group because they're not in Medicare but their health care coverage is very expensive, that those plans are supported. There's a tax credit for small businesses and small employers, small nonprofits like Citizen Action, 35%, which is a lot of money. It could be $20,000 for the average very small business to help them afford health insurance coverage. So there are a number of reforms of that kind that create a better and stronger safety net. There are requirements that states cannot cut back on vital programs like Badger Care in Wisconsin between now and full healthcare implementation in 2014. The other set of reforms is to strengthen Medicare. We all know Medicare is vital to our seniors and that our seniors have much better access to health care than everyone else because they have the Medicare system. This plan actually starts to close the Medicare donut hole, gives a $250 rebate to seniors who are in the Medicare donut hole and begins to gradually close it altogether. Also within Medicare, there is now going to be coverage for preventive care that without copays and deductibles, so first dollar coverage. There are also new improvements in quality. Hospitals will not be paid the same rate. They'll be penalized if they have a high readmission rate. That would mean that they are discharging patients and seniors early, and then they're getting sick right away and coming back in, which is very expensive and also very painful to the patient, and also not punishing hospitals that have very high infection rates, because there's no reason Medicare should be paying a hospital to cure its own infections because it doesn't have its quality control in order. So those are all reforms that start in 2010. A lot of them start in September, and in 2011. The other thing, though, that happens is that we start planning right away at the state and national level for full implementation of healthcare reform. 2014 is when the major reforms come into place. I've just gone through the bridge reforms that lead us into 2014 and keep people as secure as possible before we get to the major reforms. But starting in 2014, people who have good health insurance coverage from large employers can keep it. But alongside our current system, and Medicare is kept in place and strengthened, it is not in any way compromised. In fact, the cost savings under this plan are going to make Medicare much stronger. But alongside, we build a system that is going to work for people who don't have good coverage today. People who are uninsured, people who have to buy insurance on the individual market on their own, which means they are on their own against the insurance companies and face the worst of abuses. Also, people who work for small businesses. They're the ones who can least afford the high cost of health insurance and have dropped coverage the most just because they couldn't afford to pay. The other group, interestingly enough, is members of Congress. They will be in this plan. So people will, as we've talked about for years, have the same health care that their own members of Congress get. Now, there are a couple different features. There's going to be a Medicaid entitlement from now on for people who have modest income. So no matter, right now Medicaid is there for certain groups of people, but this will be for everyone under a certain income limit. And then everyone else will be eligible for a health insurance exchange, which is a marketplace where you would buy regulated health insurance that outlaws all the major abuses and lets you choose what insurance plan you want. You'll have at least one nonprofit option, and there will be standard benefits packages. There'll be 4, and that cover all necessary care, and you'll know what's in them. And so there'll be no more guessing as to what's in a policy. You will decide. They'll be named after the precious metals, so there'll be a platinum, a gold, a silver, a bronze. If you decide you want the silver, then you will know exactly what's in a silver plan. Then you will look at the 5 or 6 insurance companies, for-profit and non-profit, that offer it in the exchange, if you're on the exchange, and then you will choose the one you want. If you don't like it after a year, you can switch companies, and you'll know exactly what's covered, and everything medically necessary will be covered. There'll be expert commissions and doctors that will decide, not insurance company bureaucrats. So there will also be subsidies to afford the coverage. So they'll be on a sliding scale based on income up to 400% of poverty. And what that means at the federal poverty level, that means for a family of 4 up to $88,000 a year. So this will help not only poor and modest income people, but the middle class afford health care. That is the biggest, most expensive thing in this bill. There are over $750 billion in subsidies in this bill for people to go to this exchange and purchase health care, or to go to Medicaid, or to have Medicaid. And so that is a huge advance. And that is something that people need to understand, that this is one of the largest investments we have made in the health of our society and quite frankly in the economic well-being of our society, given how hard it is for so many Americans to afford health care and how many of them are driven bankrupt by medical bills. This is a huge investment in the economic security of Americans. And that all happens begins to happen in 2014. And these exchanges are created at the state level. It will be up to Wisconsin to decide how to structure it. We can add additional populations and groups to it, which also will give us more bargaining power to bring costs down. And so we are actually part of that process. I am on a commission that the legislature has created, a study committee to advise the legislature on how to implement the new healthcare reform law. So we are taking the opinions of all of our members across the state and all of our coalition partners to the table to help bang out a plan for Wisconsin so that we can be one of the lead states in getting the most benefit out of this healthcare reform bill, and also setting a standard for other states, as Wisconsin has so often done, as to how to do this and how to accomplish it. Now, what needs to be understood, and I talk about this in the longer presentation, is that it was very politically difficult to pass this reform. This is an historic accomplishment. It is also going to be very hard to implement it. There are a lot of key battles over cost, over what is covered and the quality of care, which were deferred to later in the process. And so what we need is a very strong progressive movement to make sure that the consumer voice, the consumer interest is paramount at every step. And that's what we're working on. And we need to make sure that healthcare is a positive issue in elections, because politicians will not take risks, will not do the right thing unless it's a positive issue that helps them become elected to the state legislature, to the governorship, or to Congress. And so this fight, so what happened in March, the historic passage of healthcare reform, was a major milestone in American history, one of the greatest domestic reforms to ever pass in the United States, certainly the most sweeping to pass in 50 years, but it was only a stage in the process. And we now have to win that reform in this all-important implementation phase, which is going to take years. The Wisconsin State Plan is due on January 1st, 2013, which means the next two-year legislature will make all these decisions. They are elected in the fall. So right now the discussion as to who will be in the legislature, who will be the governor, is very important to this. And then the discussion and the legislation starts right away in January that helps implement this bill in Wisconsin. And so this is a very important time, but now more than ever, we need Citizen Action members, our allies, our affiliates and friends, all involved in this process. Because if we are not in the inside, and if we are not putting pressure on decision makers, then special interests will take over and they'll make the decisions and they won't be in the public interest. But I think we can, coming off the momentum of the victory in March, make sure that the consumer voice is paramount and that we make American democracy work. This is a great test of American democracy and democracy in Wisconsin, and I think we've passed it so far, and I think we can pass it with flying colors. There are things we'd like to improve in the bill as well. We didn't get everything we wanted. That we can do in this process as well, but we have a great base to build on. One of our allies, Gene Farley, is a member of the Citizen Action Board, a longtime doctor and a longtime healthcare reform advocate, calls this bill a building permit. And I think that's a very good analogy. We've built a foundation here, and now we need to finish out the building and finish out, finally, a guarantee of quality, affordable health care for everyone in Wisconsin and everyone in America.